Hi, and welcome back. We have been getting a lot of requests to provide advice on several symptoms and complaints that some women get in pregnancy. So, we have dedicated the next few videos to talk about common symptoms and complaints encountered by some women while pregnant. The symptoms that may occur in pregnancy include abdominal pain, vaginal bleeding or spotting, morning sickness, and indigestion and heartburn. In this video, I am going to talk about the common causes of abdominal pain in pregnancy, and how this can be managed. Please don't forget to share our videos as we hope these videos will help other people too. Abdominal or stomach pains or cramps are quite common in pregnancy. The pains can feel different at different stages of the pregnancy, but they are not usually due to anything serious. However, in some women, there may be a serious underlying cause for the pains and further assessment would be required. If the pain is mild and settles down on its own and if there are no other symptoms with it, it is likely to be benign and harmless. This type of pain can be dull or sharp, and it may be due to ligaments, constipation or trapped wind. Ligament pain happens as the ligaments in the pelvic region stretch to support the growing baby. This is also called growing pains and can feel like a sharp pain or cramp on one side of the lower abdomen. If growing pains are mild, treatment is not usually required. For more severe pains, paracetamol can be considered. Ibuprofen should not be taken in pregnancy. Constipation is a very common presentation in pregnancy, and this occurs due to hormonal changes in early stages of pregnancy. As pregnancy progresses and the baby grows bigger, this can also lead to constipation. To help prevent constipation, it is recommended to eat foods that are high in fiber such as wholemeal breads and cereals, fruit and vegetables, and pulses like beans and lentils, to drink plenty of fluids, and to do regular light exercises. Trapped wind can be managed by eating several smaller meals throughout the day, eating and chewing slowly before swallowing, and avoiding swallowing air while eating. Sometimes abdominal pain in pregnancy could be due to something more serious. The causes of serious abdominal pain are miscarriage, ectopic pregnancy, placental abruption, urinary tract infections or UTIs, preeclampsia, or premature labor. A miscarriage is classified as a loss of pregnancy before the 24 weeks of gestation. The definition of miscarriage may vary from country to country. Many early miscarriages before the 12 weeks of gestation happen because there is a problem with the development of the baby. The other causes are chromosomal disorders, hormonal imbalances, and medical conditions such as diabetes and clotting problems. Most miscarriages occur during the first 12 weeks of gestation, and it is not possible to prevent them. A miscarriage usually presents with vaginal bleeding, blood clots, discharge of fluid or tissue from the vagina, followed by cramps and lower abdominal pain. Ectopic pregnancy is when the pregnancy takes place outside the uterus such as in the fallopian tube. This is usually considered a medical emergency as it can cause serious complications because the embryo cannot develop properly outside the uterus. This is treated with medicines or surgery to remove the embryo before it causes serious problems. The symptoms of an ectopic pregnancy usually occur between 6 to 8 weeks of gestation but can happen later. The common symptoms are vaginal bleeding, brown, watery discharge, lower abdominal or pelvic pain, shoulder tip pain, and discomfort when going to the toilet. Placental abruption is when the placenta starts to come away from the wall of the uterus or womb. This causes vaginal bleeding as well as abdominal pain. This requires urgent assessment in the hospital. Urinary tract infections are common in pregnancy and may cause pain or burning on urination, abdominal pain, and high temperature. They can usually be easily treated with a course of antibiotics. Preeclampsia is a condition that some women get in pregnancy. The exact cause of preeclampsia is not fully known, but it is thought to happen when there is a problem with the placenta. It usually develops after 20 weeks of gestation or just after the baby is born. The common symptoms of preeclampsia are severe or persistent pain on the right upper abdomen, severe headache, vision problems, swollen feet, hands and face. Preeclampsia usually requires hospitalization for appropriate management. Premature labor is when there are signs of labor before 37 weeks of gestation. Premature labor can present with abdominal cramps or tightening. When this is suspected, it is recommended to go to the hospital or maternity unit. It is highly advisable to go to the hospital if there is severe or persistent pain, vaginal bleeding, lower back pain, severe headache, dizziness, unusual vomiting, or pain on urination. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.